we decided to do a needs assessment of our county and see where there was an unmet need in the county. So a medical student and I plotted the teen birth rates in each zip code of our county and also visited each program that was involved in teen pregnancy prevention that was operating in our county and mapped where those services were available. And what we found surprised us. Our program was located in downtown Charleston, as were all the other programs, but the highest teen birth rate was out in the rural part of the county where there was no service available. And out of that, we created a plan that had several levels of intervention. The first was to serve the teen mothers themselves, because teen mothers are very likely to drop out of school, to have trouble being a good mother, and to have another baby while still a teenager. So we had a special intensive intervention for teen mothers that's called the Second Chance Club. Then we also had an intensive intervention for the second highest risk group of girls, which is the younger sisters or daughters of teen mothers. And we brought medical care out to the community. So the university brings medical care. That's me. I come out and see patients 1 day a week out here in this rural area that's 20 miles away from downtown, so that we, with the parents' permission and with the cooperation of a local federally qualified health center, provide comprehensive adolescent services for the kids at this school. And then we also provided education for parents and for kids about sexuality, but also just about parenting of teenagers. So the intervention involved intensive services for the highest risk kids, and also school and community education and medical care, a three-pronged approach. Well, we do have a lot of education about what is a healthy relationship. Our education is not just about STDs and birth control. It's also about what constitutes a healthy relationship, helping both girls and boys recognize when is a relationship healthy or unhealthy, striving towards having a healthy relationship. And we believe in skills-based education, not just didactic education. That serves this particular community. For example, one of the types of education we provide is a specific skills-based workshop for African American young women that's very culturally based and includes building that self-esteem so that she can insist on a healthy relationship with her partner. Our program has evolved during those 6 years. We change as the need changes every year, but we've been really thrilled that every year the teen births in this high school and in the community have decreased. So 3 years ago there were 12 births in this high school. 2 years ago there were 6. Last year there were only 3. So we are really delighted at the results. And that's not just the whole picture. The other part of the picture is how many of our graduates are doing well in high school, graduating from high school, how many college physicals I did last spring as our students go off to college. That's another part of the success of the program.